Hello, my name is Brandon Thornock, and I am the Chief Executive Officer at Shasta Community Health Center. As a valued member of our community, and possibly even a part of the Shasta Community Health Center family as a patient, we want to make you aware of a reckless statewide ballot initiative being considered in California that could undermine the care we provide for our community and patients. On August 1st, SEIU-UHW, a statewide healthcare workers union, filed a dangerous ballot initiative with the California Attorney General's office that would force community health centers and clinics like Shasta Community Health Center to cut services and push clinics across California to the brink of closure. This measure has not yet qualified for the ballot, and your care is not affected. We want you to be informed so that if you read about it in the news or see people collecting signatures at grocery stores or retailers, you have the facts and understand why community health centers and clinics are opposing this dangerous initiative. Even with this challenge, Shasta Community Health Center remains committed to providing our patients and community with the same care we have provided for decades. That's why we are part of a broad and growing coalition working to ensure this initiative never passes. So what would this ballot initiative do? On first glance, the measure may seem like a good idea, but when you dig into the actual implications, they would be dire for our health center. It would establish arbitrary rules on how community health centers and clinics like ours can spend money on patient care and community services, circumventing our patient-led board of directors. Many of you may have seen the social media posts or mailers SEIU-UHW has sent strategically to our area. The ballot initiative materials label this as the Clinic Funding Accountability and Transparency Act, and that it would require community health centers to spend 90% of their revenues on patients, caregivers, and the mission of providing care. Sounds like a good idea, right? Wrong. What the materials do not disclose is that this initiative would exclude funding for vital patient and support services from the 90% calculation, including nursing managers, chief medical officers and physician leaders, healthcare enrollment navigators, clinic office managers, administration and staff, appointment referral coordinators, administrative assistants, billing and accountants, IT system and staff, janitorial and maintenance facility staff, human resources staff, operations staff, workforce development staff, staff recruitment teams, telemedicine technology for virtual appointments, quality care improvement programs, staff training and development, translation services, patient medical records, appointment support services, care management programs, drivers and transportation services, employee benefit related expenses, legal and auditing expenses, clinics liability insurance, any mammogram, CT, or X-ray equipment expenses, building new clinics and expanding clinic sites, rent and lease of buildings, utility expenses including telephone costs, office supplies or printing costs, property and equipment insurance expenses, just to name a few. In effect, this initiative will leave millions of patients with reduced access to care, longer wait times, and fewer resources to manage their health, divert billions of dollars away from patient care into new, unnecessary bureaucracy, and place community health centers and clinics under severe financial strain, forcing cutbacks to vital patient services and pushing clinics across California to the brink of closure. So what's next and what should you look for? Qualifying a measure for California's ballot requires collecting hundreds of thousands of signatures from voters. SEIU-UHW has already moved forward with gathering signatures. If you are asked to sign their petition, be sure to first read the initiative. If you conclude, like we do, that it would harm clinics, patients, and our community, please do not sign the petition. If the measure qualifies, it could appear on the November 2026 ballot. We are already working with our partners across the state to mobilize a broad coalition of health centers and clinics, patients, healthcare workers, community leaders, elected officials, and more. At Shasta Community Health Center, we will continue to provide high-quality, whole-person care to everyone in our community, regardless of who you are, where you come from, or your ability to pay. We are more than a healthcare facility. We are trusted partners and a community anchor, where care is personal, voices are heard, and supporting the whole person is at the heart of everything we do. This ballot initiative threatens to undermine that mission by limiting the ability of community health centers and clinics to provide comprehensive, accessible care our patients and communities rely on. So how can you get involved? You can start by sharing this video and encouraging your network to watch and get informed. You can also go to www.protectpatientsca.com to review the materials and learn more on how dangerous this initiative is for our community. Finally, you can follow us on social media at Shasta Community Health Center and share any content that we post about this initiative within your own networks. Above everything else, please be a well-informed voter. We need you. Together, we can defeat this ballot initiative and ensure our community continues to thrive. Thank you.